on treating Alzheimer's with entrainment was part of a larger study involving a few dozen participants from two seniors' homes in Seattle. The study was done by Leslie Sherlin and Tom Budzinski back in 2002. So anyway, within this study, slipped in a Alzheimer's patient at one of the centers, and although she officially was not meant to be part of the study, they decided to keep her in the study to see if entrainment would help treat Alzheimer's. Her Alzheimer's was rapidly progressing. She was given the same stimulation as the rest of the group, which was randomized entrainment from 9 to 22 hertz. And quantitative EEGs, which I've been showing you all along, and Loretta's. Now, Loretta's a three-dimensional quantitative EEG, which you'll see shortly. But they were taken at baseline. Baseline we're calling Q1. After 30 sessions of entrainment, which were carried out over a 12-week period, we're calling that Q2. After 6 months, which we're calling Q3. And after 10 months, which we're calling Q4. Now, she only used the entrainment intermittently between Q2 and Q3. And that was part of the reason why, was because after her 30 sessions of entrainment, she moved back home and would walk through downtown Seattle to the seniors' home to get occasional updates with entrainment. And she stopped using entrainment altogether at 6-month period, which is Q3, and never used it again between Q3 and Q4. But because her brain was kicked in, I guess, into good functioning, it actually continued to improve between Q3 and Q4, despite her not using entrainment at this point at all. So, this is what they observed. Now, delta, of course, delta brainwaves, as we've seen with some of these TBI cases, it's tied with poor brain function, the real brain slowing, loss of cognitive ability, can't think clearly, foggy-headedness, losing emotional control, and so on. And her delta was quite high because she had fairly severe Alzheimer's at this point. What they had observed is that during stimulation of entrainment and 15 minutes post, and after 30 sessions, which were 12 weeks later, her delta was down. So it was down immediately and continued to stay down throughout the entire training period. Her QEEG showed decreased delta in the right temporal lobe primarily at the onset, but later on, and that was her worst temporal lobe, but later on the delta across the entire brain continued to go down. Loretta showed improved superior temporal gyrus and primary auditory cortex, also after entrainment and after the 30-session treatment period. Here's the Loretta here. What we can see is quite quickly her right temporal lobe activity, which was the worst issue that she had, improved, and the blue means that the delta went down. And because delta is not a good brainwave to have in excess, going down is good. So the blue means that there is less delta, and we can see it sideways here, and we can also see a slice across the ears in a sense, from front to back. After 30 sessions, and this was after the first session, after 30 sessions, the improvements were even greater. We can see more improvements here. You can see that across the board. At 10 months, the improvements were greater again, and we can also see the frontal activity here, the beta, is actually improving. Now, this graph, I think, kind of says it all. We can see that prior to entrainment, delta was very, very high, and there was no alpha rhythm, so no thalamocortical loop. And how many people with developing Alzheimer's are going to show the exact same condition as someone with a TBI or a viral infection, who with a fever that perhaps had their thalamocortical loop knocked offline in a sense. Anyway, we see that she doesn't make any alpha and her delta is high. Post-entrainment, now this is at the 6-month period, we see her delta and theta are way down, and she has an alpha rhythm again, which means the brain is back to firing the way it should. So, entrainment seems to restore some degree of spatial ability, they observed. For example, following entrainment, she was able to accurately find her way around a several block radius, including the distance from her home to the site of the training. Her walking style improved from the shuffling, flat-footed stride of many Alzheimer's disease patients to a more normal gait. She reported that the cognitive fog lifted after her training. The microcog reasoning calculation scale, and the microcog is a timed computerized test, and it tests for cognitive ability. It was improved in her post score as well as in the larger group of elderly people who were also in the study. Conclusion: entrainment appears to produce improvement in the current density. Now, current density is what they use for little three-dimensional voxels when they do a Loretta analysis. But basically what they're saying is that these brain regions that are involved in Alzheimer's disease improve in function. And the results appear as early as the first entrainment session, and they last throughout the continuation of the 30-session training program. And as we saw, 10 months later, she was doing even better yet. Now, if you're a grad student and you need to do a dissertation, I really invite you to consider doing a study with entrainment to treat Alzheimer's, which will help further clarify the EEG signature of Alzheimer's and the use of entrainment to treat it. Also, if you happen to be a researcher and you need to apply for a grant to do a study, again, especially a study on the elderly and Alzheimer's and cognitive decline, dementia, I invite you to consider looking at funding a study to use entrainment as a treatment modality for cognitive decline, dementia, and Alzheimer's in seniors.